It's a test called the Cancer Profile, and it was developed by a scientist right here in Hollywood, Florida. The test is supposed to be able to predict a malignancy before it actually develops. 45-year-old Kate Bugala is having her blood tested to see if she's at risk for cancer. The test is called the Cancer Profile.
The profile can possibly foretell the developing cancer sometimes as far as years before there is any sign or symptom, as well as they will show if there is an established cancer that, that we will find positive markers.
The test cannot tell you exactly which part of your body is at risk, but can detect potential problems. Bugala believes the test is a lifesaver.
I just had a complete physical, both gynecological and regular. They came back showing that I was just the great health.
But because cancer runs in Bugala's family, she decided to have the Cancer Profile test, since it has a 92% accuracy. Her results?
It was like beyond risk. It was almost a sure thing. That's how bad they were.
So she began to make lifestyle changes, like in her diet and the way she handles stress. A year later, the Cancer Profile was repeated.
Everything was back in normal range. Everything.
So why don't all doctors use the Cancer Profile test? Schandl says many simply don't know it exists.
Doctors are familiar with a liver profile for the liver, or a cardiac profile for the heart, or a lipid profile for various cholesterols and fats in the blood, but they are not familiar with a cancer profile.
Now, it's important to remember that a negative test doesn't mean that you won't develop cancer. Dr. Schandl recommends having the test every year. Most insurance companies will pay for it.
The American Cancer Society says almost half of the people watching this story will get some form of cancer. So wouldn't it be convenient to have some sort of warning? A South Florida doctor says he has the answers. Medical reporter Sally Lewis joins us now with that story. Sally?
Well, the answer, he says, comes in the form of a blood test. Dr. Schandl says he can tell who is likely to get cancer. He believes his patented blood test can save lives by helping prevent the disease.
All my friends and relatives who went strictly the traditional way are dead.
Dr. Schandl has a very powerful message about cancer. He believes cancer can be prevented.
The cancer profile that I have developed can foretell a developing malignancy years before there is a tumor.
Dr. Schandl does this by looking for what he calls tumor markers in the body. If a marker is elevated, he works to bring it down by changing a patient's metabolic level. Using minerals, enzymes, fatty acids, and vitamins, he tries to keep cancer at bay.
You cut your hair?
Just a little bit. Marie Thibodeau of West Palm Beach is a strong believer. A breast cancer survivor, she has her blood tested every few months for signs the cancer could be coming back. She follows a strict diet, exercises, takes 70 vitamins a day, and tries to stay stress-free.
I feel less worry.
In her case, Dr. Schandl looks for elevations of an enzyme that could signal breast cancer, CA15.3.
Because you never know when it's going to come back, if it's going to come back. You hope it's not going to come back. And with the test, with the diet and the mindset that you have to have, you definitely feel more confident.
This type of alternative form of medical care works for Marie in combination with traditional forms such as a yearly mammogram. So far, she's cancer-free. Those blood tests cost almost $250. Now, Dr. Schandl says he does accept insurance. If you would like more information, you can call the American Metabolic Laboratories in Hollywood at 954-929-4814. And you can also get the information on our website if you'd like to look at it. It's www.wpecnews12.com. Very interesting food for thought.
And a lot of people are seeking these alternative treatments.
A lot of people are, yes.
Thanks, Sally.
Okay.
Christy, they come here to the Cooper City Recreational Center to practice the type of martial arts known as Gojo. They trade in their scrubs for sweats, and this is not just physical activity that they're doing to them. This is truly a matter of life and death. They're biochemists, surgeons, paramedics, chiropractors, and this night they are practicing saving lives, their own.
I have almost physically remove people from my office on a rare occasion when they come in and they're disrespectful.
It is a phenomenon of the 90s. Doctors coming in as patients, victims of workplace violence. Aventura Dr. Bradley Silverman shot in his office. Dr. Christina Smith killed in the hospital psychiatric ward.
Line up, guys. Get your gear off.
Doctors are not only taking note, they are taking action.
So it's here. There goes the knife.
Coming to the man they call Master K to learn martial arts street style. So many are coming, in fact, that he started offering one-night survival seminars for medical professionals.
They become targets, and now they're interested in a self-defense mechanism. You know, so they approach me with, what can you do to help me train in a way that'll protect me?
But you can't expect to learn how to disarm a gunman in just one night. Did that work?
Yes.
Trauma doctor Lawrence Lautenberg.
He was at work?
Has been working at it for 14 years.
When I see a colleague of mine get shot down in his office, when I see a physician's assistant get stabbed in a doctor's office, when I see a plastic surgeon get shot in California, it's going to be in People's Magazine this week, you have to think about it. But the way I think about it, because of what I've done over these last 14 years, is that I have enough confidence to be able to handle the situation. That doesn't mean I'm going to fight. I'm really not going to fight. I don't want to fight. I have enough confidence to recognize the situation and back away when it needs to be backed away.
Doctors have also told me that this type of martial arts allows them to clear their mind, think less about the possible violence that could happen in their offices, in their hospitals, and concentrate more on the patients and their care. We're live in Cooper City. I'm Kelly Kobiella, Channel 10 Eyewitness News on the Night Beat.